this Dr. Moriarty?
Yes.
My name is Rachel Ashton, and
Yes, tell me,
a friend of mine called, and
which friend?
a woman named Dorothy Matson.
Hold it a minute now, hold it. Yeah, I'll be able to get a hold of Barbara, and she'll call you in a half hour. In the meantime, I just want to tell you a few things, about 4 hours, whenever the appointment is arranged by Barbara, 4 hours before, you eat a light lunch like a piece of toast and a glass of milk, and I think she'll expect you to bring $750 with you, and try to make it in large bills, like hundreds if you can, so we don't spend all night counting it. So she'll call you and tell you when and where she'll meet you.
Okay, fine.
All right?
Thank you very much.
You're welcome.
Goodbye.
Bye-bye.
Oh, Rachel, come in. Have a seat. Oh, do you want to leave things on the table over there? It's a little warm in here. Oh, you can put that on the table, too. And the pocketbook you can put over here. I'll put it down here for you. Yeah. I'm going to have a seat. Yeah, Barbara told me all about you. And, you have a problem, and it's not comfortable, but at least you've come to the good place. You could have gone to a back alley somewhere, you know. So you did come to somebody who knows the business. There's one thing you will learn here is you'll get a course in gynecology anyway. I'm sorry I have to cover up, but you know the reason. I don't want to be known. But you had a reference from somebody, a friend of yours, or somebody you know, a Matson. And she must have told you a little bit about how we work here.
Well, not very much. She just said to call you
And I'd tell you. Yeah. Well, all right. Anyway, you don't have to feel obligated. If after I'm done getting everything ready and explaining things to you, if you decide that you don't want to have this done, you can pick up your money and go home.
I want to get it done.
I say, it's up to you to feel confident and relax. All right, I'm going to set up my equipment now. So, put this over here so I'm out of my way temporarily. And we deal, you know, with the high-class newspaper, the Wall Street Journal. Well, they put it down so in case the uterus gives a little squirt, I won't spoil my run, see? Okay, Ray, you sit on the table. We're all set. So lie down and put your heels in the stirrups. So when you're in position, then I can put the mask on, then I'll be all set to wash my hands and go to work. All right. Now lie down, huh? Yeah, lie down. Now, slide down to me. Keep your knees apart. Way apart, way apart. That's good. Now slide down over the hole. Over the hole. A little more.
Ouch.
Ouch. That's the rump. That's where you're going to be. All right. All right. Now, I want you to hold this in your right hand, thumb under there, that's right. Now you put it to your nose and face and start to breathe. And keep your chin up a little bit so that when it drops, there'll be room to drop. That's right. All right. Now stop in a few seconds. Keep puffing.
And everything about him was really scary. There was just nothing reassuring in his manner. I suppose he was medically all right. I had some complications afterwards. I didn't end up in a hospital, but there were a lot of private doctor's bills. But I could see a rusty curette clear across the room, and there was dust all over everything and ashes and, I mean, the whole office. If I hadn't been so desperate, I just would have turned around and walked out. At that point, I really didn't care, though. I would just as soon have died rather than not get the abortion. One thing I really hope is that with all of the changes in the laws that are going on through the legislatures and the courts, that nobody will ever have to go through this again the way I went through it.
Rachel Ashton is one of perhaps 1 million women in the United States who each year chooses to have an abortion. In more than 500,000 cases every year, an operation which would be relatively safe and simple if performed under proper conditions becomes a major health hazard. There are many people who consider abortion immoral, and there are many others who believe the immorality lies in compulsory motherhood. It's not the purpose of this program to engage in that debate. There's no reason for one group to impose their views on the other. In the 1970s, the laws restricting abortion will change rapidly throughout the United States. However, while the laws are changing, the subject will still remain one of controversy, and that controversy will have its effects on the emotions of women confronted with the problem and the choice. The emotional health of a woman who makes the choice is primarily related to whether she believes she is acting in a morally responsible way, whether or not the circumstances under which she will have the abortion are legal and humane, and how far along her pregnancy is when the operation is performed. The medical definition of abortion is the termination of a pregnancy before the end of the 20th week. This program will deal with women who are in the process of terminating their pregnancy before the end of the 12th week. During this period, the procedure can be performed without a hospital stay and with less medical risk than is involved with childbirth.
I have a little girl already, and I got her just in the middle, sort of like in the middle of my second semester of school, and I don't, want to drop out. Whereas I'm on a full scholarship, and it's like, a chance that you get like once in a lifetime.
And I just decided I would go off for 3 months, and it came the 3rd month when I was going to go back on my pills, and I didn't have my period.
But when I stopped to really consider what it would mean by trying to spend time with it and working to support both of us and maybe cheating both of us in that way, I just decided it was totally impractical and not fair to me or the future child. So I decided this was the best way, and I don't have any regrets.
I say my husband and I didn't plan a family at all. We aren't planning a family now or in the future. Times are changing, I think. Before, people had no choice. Now they do.
Before we get into that, let me just gather a little information.
What's your religious background?
Roman Catholic.
You're Roman Catholic? You know, the Roman Catholic Church has a fairly strong position on the question of abortion.
Oh, yes, we know.
How do you feel about that?
Well,
we don't agree with it.
We don't agree with their position on it. Obviously, we would not be here, probably.
You see that this is a viable option for a woman to elect then?
Yes.
Yeah.
Carol, how'd you get pregnant? Did you use any contraception?
Well, yes, we did. I went on the pill right after Leah was born, but I thought I gained weight from it.
Yeah.
So we started using foam. And my doctor told me that it was 90-something% effective. And though since I've been thinking I've been pregnant, I've been talking to people, and they seem to think that it isn't that effective, but that's what we use.
So this was really, in a sense, a contraceptive failure in terms of your family planning, right?
We have a lot of reasons for not wanting to have a baby right now. We want another one eventually, but right now my husband is right in the middle of graduate school, and from a financial standpoint, it isn't really feasible. I don't know, it's just like, to me, well, when my mother and Wally's mother, after they had had their first children, within 13 months, they had 2 other kids. You know, I mean, like, Wally was 4 months old and I was 4 months old, and they got pregnant again. And they just accepted it. You know, what else could they do? That was 20 or 30 years ago. They just thought, well, you know, I have to have a baby. What else can you do? But the way I look at it, right now, you know, nowadays you have an option. If you get pregnant, then you can stop and ask yourself, do I really want to have this child? And if you don't really think that it's wise for you to have a child at that time, then you can go ahead and have an abortion performed.
Let me ask you a few questions. You look like you're in pretty good health, is that right?
Yeah.
Have you ever had any health problems at all?
No.
You also seem to me to be emotionally very well balanced. Is that pretty, pretty true?
I think so. I think I do all right. Just as well as anybody else, I guess.
Yeah, you see, unfortunately, if you were emotionally disturbed or you had some health impediment, we could help you in Michigan.
We checked into that. Yeah. We have a friend who's an intern, and he told us that there is a hospital in this area where we might have one done legally, but you have to go to a psychiatrist, and you have to prove to him that you're mentally unstable. So, I mean, I'd have to, like, get really dramatic and say I'm going to kill myself if I have to have this baby, which isn't really, you know.
It's a pretty degrading thing for women to have
Yeah.
to go through.
I mean, I'm sure that if I had no other options, I could manage it, you know, having this baby. But like I said before, why should I have it if I don't want it right now?
I'm going to suggest to you that you use our New York facility, because their philosophy there is consistent with ours right along the way. They're going to be receiving you as you come into the facility, understanding how you're feeling, understanding the questions you have, the kind of worries you might have, and so forth, and they're going to set you at ease and also help you understand what's going to happen to you, I mean, as far as the abortion itself is concerned. They're also then going to be concerned that obviously your birth control isn't as effective as it ought to be, and help you correct that and advise you. No. Then also, after you've been to New York and come back, I want to see you again, because I want you to have a chance to sit down here and kind of reflect upon it as you look back on it, talk about it, and tell me, you know, how you feel, and just have a chance for you to get it all off your chest and look ahead into your life as you're going on and just seeing what your feelings might be. I'm concerned about you, and I want to make sure that everything's going well for you.
I see by your form that you have one child.
That's right.
And your last period was on November 15th?
16.
16th. Was it a normal period?
Yeah.
Have you been seen by a doctor?
Yeah.
You had an examination?
Yes.
Okay. And did you come through the clergy service?
Yes, I did.
You were examined on the 8th of January, and you were 6 weeks pregnant then. So that would make you about 8 weeks now, right? Okay. Well, you came at just the right time. 7 to 8 weeks is a good time to come, because it's easier for you and it's easier for us. All we're going to do here is just have a little chat about, I'm going to explain that entire procedure to you so you know exactly what's going to happen when it's going to happen, and I'll be with you in the other room, and I'll tell you what's going on then too. Okay. We don't give you any surprises here, and you'll know everything that's going on.
Okay.
All right, well, why don't we go into the procedure? Okay? Now, I would like you to pretend that you're laying down, okay? And your head would be up here, and your legs here. This is your stomach and your back, okay? Now, this is a life-size model. This is just as big as you are. Does that surprise you? Okay. Now, all we're going to do first in the procedure room is give you a pelvic exam. Have you had a pelvic before?
Many times.
Oh, good. Okay, well, that won't be anything new for you. I will examine you, and so will the doctor. And the reason that we do examine you is just to denote what shape your uterus is in and how pregnant you are. After that, the doctor will put in a little steel instrument. It's called a speculum. You ever heard of that before?
Yes.
Good. Have you had a speculum put in your vagina before?
Mm-hmm.
Great.
For pap smears, I use those, don't I?
Right. Exactly.
I just had one a couple of weeks ago.
Oh, good for you. That's good. You should have one once a year.
I know.
Good help. Many women come and they've never heard of a pap smear. And
I have one every year.
Cervical cancer is a leading factor in causing women a lot of trouble and death. And pap smear is a very easy way to prevent
I'm very good on pap smears. Not so good on not getting pregnant again.
Well, that we're going to alleviate.
Thank you.
Okay, and we got to inserting a speculum. It doesn't hurt. It just feels a little cold. Now, because your uterus floats, and we must stabilize it during the procedure, we are going to put a little clip right here on your cervix. Now, when the doctor puts the clip on, you're going to feel a pinch. Okay? And I'm going to tell you, Carol, you're going to feel a pinch now. One pinch, just as if I pinched you on the leg. Once it's on, you won't feel it. Okay? After that, you will get a local anesthetic right in here, okay? And that will feel like a mild cramp or a filling of fluid in your lower abdomen. Now, another thing is you might feel when the doctor puts the anesthetic in is a slight ringing in your ears or dryness of your mouth or like when the dentist gives you Novocaine and you feel like you're slurring your speech. Mm-hmm. Okay, that's not anything to be alarmed about. It's common. Okay. Some girls feel that way, and some girls don't feel that way. In order to introduce the suction tube into your uterus to remove the pregnancy, we must do a process called dilation. Now, you've had a baby, right? So you know when you carry a full-term baby, the cervix would stretch up to about that size, and that's what labor's all about. Well, in order to introduce the suction tube, as I said, which looks like the pen, okay, we will gently insert a series of instruments called dilators. The dilators cause cramps, okay? And the cramping is uncomfortable. Some girls have more severe cramping than others. And I'm not telling you this to frighten you, but more to make you aware of what's going to happen.
Now, I've always found that if you know what's going to happen, it's a lot easier to handle than if something surprising happens. When I had my baby, I took classes and found out exactly what was going to happen in labor, and it made it a lot easier instead of having a big surprise or something. So I agree with that.
That's why here we tell you exactly what's happening. Also, when you are going to experience the cramp, I will tell you, Carol, you're going to feel a cramp now, okay? Now, I'd like you to remember a couple of things about this dilating. Number one, it'll only take about a minute. You will only have the cramp when the dilator is in your cervix. Once it's taken out, you will not have the cramp. It's not one of these big, long, horrible pains. So I would like you to remember a couple of things. The dilating will not take long. I would like you to relax as much as you can from your waist down. You have muscles in your upper thigh that anchor in your pelvis. And if you tighten up your leg muscles, you're going to tighten up your pelvis, and it's going to be a little more difficult for you. Now, after the dilating is over, the doctor will put in the suction tube. You will hear a noise like a quiet vacuum cleaner, okay? We call it the mini vacuuming around here. That will go on for a couple of minutes. You might feel some mild cramping, nothing that you can't handle or that's severe. Some of the girls tell me it feels like a slight pulling. Believe me, all we're going to remove is your pregnancy.
Thank you.
Okay.
I wouldn't want to have my uterus sucked up in
Oh,
there.
no. That won't happen.
Okay.
Now, after that, we will check to see that your uterus is empty and clean, and it is contracting, and we're all through. That's it.
Sounds really
From
easy.
start to finish, it will take less than 10 minutes. Much less. You're only
Really?
about
Less than 10 minutes?
7 or 8 weeks pregnant. Yep. Okay, now, do you have any questions about the procedure?
Not that I can think of.
You understand what's going to happen?
Yes. I
Okay?
think so.
Feel free to ask me anything you want, here or inside. And I'll be
Okay.
telling you step by step what's going on.
Okay.
Okay? Now, how do you feel?
Fine.
Good?
Anxious to get everything over with.
You want to
but
get it
fine.
over with?
Yeah.
Okay. We'll get you up and away. Dr. Johnson, this is Carol.
Hello, Carol. How are you?
Hi.
Carol is
Hi.
from Michigan, and
Yeah.
she's only about 7.5 weeks pregnant. Her last period was November 16th. And she's very normal and has a good blood pressure and pulse. And she's had one child.
Why do you want to have the abortion now?
We just feel, my husband and I, that it's not a good time for us to have another child.
Yes, it's a little too early now. You have
Well,
what needs
not
to be-
only that, we don't have the money, and
Yeah.
we just don't feel emotionally that it's a good
Yeah,
time.
well, I agree with you. I think you shouldn't have any children that are not wanted and where you can't take care of them properly.
The first thing the doctor's going to do, as I told you before, is he's just going to examine you. Carol, I want you to concentrate on letting your legs go.
Oh, okay.
Okay, and relax.
All right.
All this is, you're feeling, is the anesthetic. Okay?
And it means it
Is
will
that
go
ever
over the-
weird?
Well, I'll try my best to make it a little bit more painful.
Now here I feel a little bit of
Okay,
something.
see? All you
Okay, you're going to
do
have a
is,
couple more, that's all. Okay,
Now that
two
I
more
felt a
prayers.
little bit.
Okay, want a hand?
Yeah.
Okay.
And I have the London 2 section
okay.
to that, please.
Mm-hmm. And the roughest part is over. You did great. And
I didn't do anything.
No, you didn't feel very
I
much
wish
at
I
all.
still had that anesthetic, though.
Now you hear the vacuum.
Yeah.
Okay.
You open your legs just a little
All
more,
right.
please.
Good girl.
I really can't believe this is
It
happening.
really is. This is going to be over quickly. Okay?
Okay.
We're almost through, and then we'll just check that we have everything.
Okay.
And then it'll all be over. You'll have nothing more to worry about.
Oh, good.
Carol, you're doing very well.
Thank
You
you.
really are. It's not half as bad as you expected it was going to be, right?
No, it really isn't. It really isn't.
Well, we got everything out the first time. Can I take that
Mm-hmm.
now?
Is it really all through now?
Well, I have to check it once more with a
You
special cuvette.
Dr. Johnson, you are so thorough.
Well, I tell you.
But I'm not complaining.
Okay, now
I
right
don't
now
know.
I want you to just be quiet for
Yeah.
1 second, okay?
All right.
That's it. You're all
That's it?
through, and you're not pregnant anymore.
No.
Feel better? That it's all over?
Yeah. It just seems so strange that I'm not pregnant anymore.
Right. The speculum's out? Everything's
Well,
out?
No.
You can always.
It's
you
really
want me to
like
put
a
this
relief.
here?
That's fine.
Just give me a sponge. Got some very interesting news for you.
What?
You're not pregnant anymore.
You know, this really sounds strange, but I really am looking forward to the next time I'm pregnant. Only I'm going to make sure that the next time is the right time. Right.
Okay. Goodbye, dear.
Okay, thank you.
Thank you, Dr. Johnson.
Looking as good as ever.
Okay, I'm going to put this down, and I want you to sit up, and I'm going to give your instructions to read, okay? The ones that we spoke about before in the other room. And I'll just be in the bathroom here cleaning up while you're reading. And then when we're through, you can get up and put your napkin on and get dressed and go.
But when it comes to birth control, I intend to maybe see Planned Parenthood or some other organization which, you know, whose purpose is to help you not get pregnant unless you want to.
Exactly. Obviously, you are fertile, and you must use something, and foam does not work.
Absolutely. True.
Okay? So I really would like you to give this a little more thought. Since you have had a problem, I wouldn't sit here and say, now, Carol, I think you ought to take this, or I think you ought to do that. That's for you and your husband to decide, and go to a doctor and get his advice and his feelings about it.
Okay. I think that might be a good idea.
Well, I recommend whatever the woman feels most comfortable with. Quite clearly, the most effective method of birth control, temporary method of birth control, is the pill. It has the smallest percentage of failure, 0.5%, meaning one woman out of 200 on the pill still gets pregnant. But that's that's a pretty small percentage. Of course, if you fall in that statistical category, you don't care how many women are with you. But it is the most effective method available for a temporary method of birth control. Also, it's very good in the sense that it's unobtrusive. It takes into consideration what's going on between the man and the woman. It doesn't get in the way, and I think that's a very important consideration.
Well, because I don't trust myself on a pill.
You think you might forget?
Yeah, I'm very forgetful about pills.
Yeah. Well, maybe then the better thing for you to do is to use something like an IUD, because that's something you can forget about. You don't even have to think about it every second or third month. It's simply a permanent installation is what it amounts to.
Yeah, but a lot of people have trouble with that.
Some do. That's true. Some do. What is that?
That doesn't mean
I'm not familiar with the term, to tell you the truth. IUD?
Yeah.
Intrauterine device, coil. Loop, spiral, all of those fall under the category of IUD. The textbooks say 1.9% failure on those. That is to say, 2 women out of 100 on the IUD will still get pregnant. But it does have the advantage of the fact that you don't have to think about it once that it's inserted.
Well, Laura, what about diaphragms and these various type foams that they have out that are non-prescription and can be bought at any drugstore?
Okay. Foam, right. It doesn't have to be on prescription. You can buy it at the drugstore. There is that advantage to it. But it doesn't work very well. And also, to me, but, that's a matter of taste, it tends to be, I think, very obtrusive. Diaphragm, I think, is very good for a woman who isn't sexually active. She just needs it once in a while. That's a very good method. Some women don't like it because they feel, I don't want to say, please excuse me, and then have to go to the bathroom. That's no good, is it? It can be inserted whether or not you think you're going to be having intercourse, say at supper time. At 7 o'clock, when you finish your dinner, you can go into the bathroom and insert the diaphragm with the jelly on the backside, the jelly being a spermicidal action to it on the backside. But that spermicidal action only acts for, say, 6 hours. So if you insert it at 7 o'clock, the jelly's only good until 1 o'clock in the morning. Yeah. But the physical barrier of the diaphragm is still there. The diaphragm with the jelly is a two-way contraceptive method. To me, the very best method we can't do anything about. That's a vasectomy. That's a permanent method of birth control used by the man. Unfortunately, a lot of men are very uptight about that. They tend to think that their performance is going to be affected by this. That isn't true. But indirectly it can be affected if the man thinks, right, psychologically, if he thinks that, he's not much of a man anymore. But it is the most effective method available.
Have you thought about having children in the future?
Oh, definitely, yeah.
This is something you want?
Oh, for sure. It's a different feeling. It's really strange. I didn't think I'd have it, but I look at a child as a human being, and I could have had one of those if I wanted. And I think I have a lot more respect for life in general, I guess.
It's a fascinating comment because, of course, one of the things that people who think the abortion laws ought not to be changed say constantly is that abortion is a disrespect for life. And it leads to and comes out of a disrespect for life.
It shows you how much more there is to life.
The myths that are involved.
For me, I became more aware of when I am a parent, how I, will want to raise my child. I've become more aware of the responsibilities and just what a child is.
You want it to be deliberate, not accidental. That's no way to start the whole process of a life off as accidentally, you know.
And I think when you actually have it, you want to give them something that, you know, they'll have everything, and you don't want to bring them up where they're unwanted. I think, you know, that feeling, whether you show it or not, you know, always creeps in, you know, no father, and it ruins your plans. So you have to more or less have a feeling against it. And I think it would, you know, be a terrible way to bring up a child.
I think the whole issue must be approached from the sex education angle. And that's where it has to begin, with learning to prevent these unwanted pregnancies and to avoid the abortion route. It has to be, young people experiment with sex. I don't think that's a very good word, but I mean, it's only a natural thing to do. All of them don't, but the ones that do should know that it doesn't have to be a risky thing, you know, a lot of people have bad attitudes toward the whole sex thing because there's guilt in it and there's fear in it and just all kinds of bad things, you know, and this is a societal problem, you know. It is too often a dirty thing, and contraceptives aren't, young girls don't want to take them if they're single because that means that you're indulging in some kind of sex activities, and it has a bad connotation to it. And I think it's got to start down there someplace with the young kids, and you know, they have to know about not just what their bodies do, the organs and all that kind of stuff that girls learn about and young guys learn about. But, you know, okay, when you do use your bodies, then what does that mean?
We all were there in the waiting and different states, different ages. Different backgrounds, you could tell just kind of by looking at each other. There were some who looked really like offbeat, maybe types, and
all kinds of
and then there were some older looking women who were probably just, you know, housewives or secretaries or something. There was a nurse there. There were a couple of girls in college, and you know, in a few minutes we were all friends.
Sure.
and because of the situation, we could all level with each other about it. We were all in the same boat, and we all understood each other's problem. And I think we helped each other a lot,
Oh, I
too.
know you did.
You know,
How does your husband feel about it now?
He made sure that I wanted to do it. And then when it was all over, he said that all along he was for it 100%. You know, but he didn't. He wanted to make sure, like I said, that I was the one. So he never prodded me into it or even suggested it. I was the one who brought it up.
When do you feel that life begins?
Intellectually, I don't feel that it becomes a human being until it's born. Emotionally, I could not have an abortion once I felt life.
Yeah.
I don't think. You know, I can't say 100%.
I think
sure.
many women feel that.
But, you know, having experienced that, and of course, by the time you feel life, I didn't feel my baby till she was 4.5 months along. So I think by that time, most people will have either had an abortion or not, you know, so it's really not much of an issue, that, I don't think. But I don't feel that as far as killing is concerned, that you're killing until the baby's born. And, you know, like I said about holding life sacred, to me, the worst thing, what really is a matter of not holding life sacred, is to allow so many unwanted babies to be born in the world. I mean, these people that say, you know, it's terrible to kill a human being. What kind of a life are so many unwanted babies living? You know, is that holding life sacred to allow them to grow up in conditions where parents don't love them?
The concern not only for life, but for the quality of the life.
Right. I mean, I feel that just to be alive means nothing. You have to be alive and happy. And if you're not wanted by your parents, and you don't have love from the time you're born, I don't see how you can be happy.
Well, Carol, the answer that people have given to just what you said up to now is that if people are unable to have children or undesirous of them, then they shouldn't have sexual intercourse.
I think it's completely unrealistic to assume that people are not going to have sexual intercourse. They do, and that's why we have families of 10 or 12 children, and, you know, and maybe they didn't even want more than 2 or 3, you know.
And also the fact is that we do not have birth control that well developed that it prevents every conception
Right,
that is desired, and people are just people and they make mistakes.
Right, yeah.
Hopefully you can now better understand the minds and emotions of women confronted with a difficult decision, and at best an unpleasant experience which once over they will strive to forget. They have shared it with you because they felt strongly there was a need for you not to agree, but simply to understand. If you think you are pregnant, the first thing to do is see a doctor immediately and find out for sure. If you are uncertain about wanting to continue the pregnancy, take the time to discuss it carefully with a trained and qualified counselor. If abortion is your choice, have it performed by a doctor in a recognized medical facility. The most important thing I can tell you is the earlier that it's done, the safer it will be, and probably the less costly. We must educate people, both men and women, on the use of contraceptives, the advantages of voluntary sterilization, and make every effort possible to develop safe, effective, inexpensive, and universally available methods of pregnancy prevention to those who would choose them. Methods that do not require women to pass judgment on a potential human life already conceived. If we can achieve these goals, then the need for abortion will be greatly diminished. It will then be necessary only in the failure of contraceptive measures or the careless failure of those not to use them. We have arrived at a point in our history that dictates an urgent reevaluation of the quality of human life. The least we must do for mankind is try to guarantee that each child born is loved. That each child born